Hi everybody, this is Dr. Harry. Recently, I found myself having to explain what fatty liver is to more of my patients. And so today I wanted to take a little bit of time, just a small bit of time, to talk about fatty liver, what it is, and what we can do to perhaps decrease our risk of getting fatty liver and even to improve our liver if indeed it does get fatty. So ultimately, there are two types of fatty liver, okay? So the one that we're talking about today is non-alcoholic fatty liver disease, and the name pretty much sums it up. It's a fatty liver that's caused by other things besides alcohol. And believe it or not, the incidence of this is actually increasing not just in this country, but around the world. And so I wanted to just have a brief discussion about it. So what causes fatty liver disease? Like, what are the major contributors to fatty liver disease? Well, the major contributors seems to be inflammation and excess sugars. So what are things that can cause inflammation and excess sugars? Things like, number one, insulin resistance or diabetes. Those two conditions have been linked with increased fatty liver disease. And so what happens is that the excess sugar that tends to create inflammation is also stored as fat in the liver. So the liver ultimately gets damaged from all of this fat accumulation. And when it gets damaged, scarring occurs and the liver cells no longer function normally. So the normal function of cleansing the blood, just really helping us to clean out a lot of the potential toxins that we take in, or even just normal things that we take to help us, such as medications or even the foods that we eat, needs to be processed by the liver at times to be cleared out of the body. And so the liver is really, really important. Other contributors can be obesity. And let's talk about that for a minute, because it's really about the fat, the inflammatory fat cells, and not all fat cells seem to be inflammatory, as we've spoken about before. It seems to be primarily the abdominal fat that contributes to this, and primarily the fat on the inside, or the mental fat. Because interestingly enough, people who seem to have a larger percentage of fat in their thighs, those individuals seem to be protected from increased inflammation and seem to be at lower risk for things like high blood pressure, for example. So it really is where this fat is distributed and how inflammatory it is that can potentially contribute to you developing fatty liver disease. Increased intake of refined carbohydrates is also another risk factor for fatty liver disease. So primarily sugars and white starchy foods that pretty much acts in the body as sugars. And again, it's not bashing any one foods, any particular group of foods, but just understanding that certain foods in excess can cause issues. And that even includes protein in excess, but that's a topic for another time. So ultimately, what we want to do here is develop a lifestyle that reduces our risk of fatty livers. And here's some things that you can do. Reduce your consumption of refined carbohydrates or sugars. And that goes really well for heart disease and decreasing your risk of diabetes as well. High fructose corn syrup should absolutely be eliminated from the diet. Interestingly enough, studies that were done shown that the Mediterranean diet may actually start reversing fatty liver disease. And so that is one way. And so as we know, the Mediterranean diet, of course, has a good deal of healthy fats in it, like omega-3s, which has also been shown to reduce the risk of fatty liver disease. So it's high vegetable content, high concentration of good fats, and that's the way to start eating dietarily. Believe it or not, exercise, high intensity training, or just really getting moving has actually been shown again to reduce not only the risk of developing fatty liver disease, but actually reducing fatty liver. Let's say you started to accumulate fat in the liver. And you care about fatty liver because if it's not addressed, it can actually lead to liver failure or cirrhosis. So it's really important that you do consider it. So, for example, when you go to your doctor and you get your annual labs done, one of the things that may come that they look at is usually your liver enzymes. And so if those are starting to elevate, that may be a trigger for your doctor to start evaluating you for possibly fatty liver or other causes. So this is a brief presentation of non-alcoholic fatty liver disease. It's not meant to be overwhelming. It's just to give you a brief explanation of what non-alcoholic fatty liver disease is, as this has been coming up a lot in my practice lately. So hopefully I've answered some of the basic questions for you. Please discuss it with your physician if you have specific questions regarding your particular concern or your particular health. Until next time, this is Dr. Harry. Bye-bye.